Testing? Testing? Good? All right. All right, it's 12 o'clock, so why don't we get started? I am Kate Junger. I am a pediatric psychologist, and I work at Cincinnati Children's. I feel weird sitting, I'm just gonna stand. So I work at Cincinnati Children's Hospital, and I work primarily in their, can we turn it up? We will ask. Yeah, I'm not sure. I don't think I have any, wait, let me see. I'm not sure I have control over it. I don't see. Yeah, okay, I will talk loudly. Can you hear me? No, okay. So I work at Cincinnati Children's, and I do a combination of clinical work. I spend most of my time in our Comprehensive Epilepsy Center with two of our teams. I work with patients newly diagnosed with epilepsy, and I also work with our patients who are seen by our teams that specialize in intractable epilepsy. So I work with a lot of kids who have really treatment-resistant seizures and who may be not only exploring medicine, but also be pre or post-surgery or do things like the ketogenic diet. And then in terms of research, I do a lot of research on quality of life and adherence research in kids who have epilepsy. So kind of the idea of today's talk was a lot of the work that I do is to support not only kids and teenagers when they're diagnosed with epilepsy, but kind of the whole family. As I'm sure you are all well aware, it's a huge shock to the system and can really lead to pretty dramatic, at least short-term changes in the family and potentially quite long-term changes as well. And we know that in order to help kids thrive, we really need to help families thrive, which includes any caregivers, parents, grandparents, anybody involved in the family, as well as siblings as well. There's also been more attention recently to, so stress is kind of something that taxes our coping resources and over time can lead to more feelings of burnout. Everyone can feel stressed, and what we want to do is kind of manage stress to keep it at a healthy level so it doesn't lead to your own kind of emotional or physical issues over time, but that's a little bit separate from medical traumatic stress too, which is kind of similar to what, I mean, in the news typically what we hear is soldiers with PTSD, but what we know from the medical research is actually parents of children who are sick and particularly medically fragile have high rates of PTSD symptoms as well. So I did not realize that I couldn't show slides today. Feel free to take a picture of this. These are lots of great resources that you can look up online. So I'm going to kind of wing it and just answer questions, but if there's anything that I've made a slide about, we can certainly talk about it. So kind of anything, what is it you all want to talk about in terms of how this has impacted the family? Yeah?
Something that we recently realized, I should have realized this much sooner, but the impact of seizures, like length of duration on siblings.
Mm-hmm. Mm-hmm.
Kind of working around that process.
Mm-hmm. How old is your daughter?
14.
14. And how long has epilepsy been a part of your family?
For retirement. But it's our son who has epilepsy.
Your son who has epilepsy.
He witnessed a pretty traumatic seizure that lasted 13 minutes.
Mm-hmm.
A lot of EMT and things like that. And so that has had the most, I would say of all of them, the most impact, and just that process of having to change plans.
Uh-huh.
And seizures happen, or we had planned to do something as a family, but now this has happened.
Mm-hmm.
So now we have to, it's obviously impacted her a great deal, and I just put that together because the focus has always been on our son.
Right, right. So these are all great points. So everyone can hear. The question is, or kind of the thing to talk about is siblings of children who have epilepsy may witness really kind of scary seizures. So the particular, it seems like, traumatic event was a 13-minute seizure and paramedics were called, and it was very scary. That kind of a lot of times when kids have epilepsy, it's very unpredictable. You never know when a seizure is going to happen. You never know how serious the seizure might be or what is going to happen, and then family plans may have to shift unexpectedly. So kind of how families cope with that, as well as when a child has epilepsy, particularly uncontrolled epilepsy, sometimes they can take up a lot of the energy and attention of the whole family, because in order to keep them safe and help them move forward, it really consumes a lot of the resources of the family. But then there's this potential that the other siblings who are involved or people in the family might feel like they're not getting the amount of support that they need. I will also say you may feel that about your other children who don't have epilepsy, but there's a big body of research to show that probably a lot of the parents in here might be neglecting those needs for themselves as well. So in terms of kind of things to watch for,
in that situation, how do you feel about individual therapy for each person versus family therapy?
So I think both can be great. The question is individual therapy versus family therapy. I think it depends on what's going on in your family. So for children, it kind of depends on their age and developmental level, but things to watch for. Seizures are obviously really scary, and when they happen, they kind of evoke this fight or flight response that we all have. So when we're in danger, we have all of these changes in our body that happen really quickly that allow us to respond and really keep ourselves safe or react to people or react to things around us. What can happen when people go through a traumatic event is you have that initial event that is very scary and dangerous, and that it's perceived by the individual as life-threatening. So one of the things that's important to pay attention to is the actual event that creates a trauma for anyone in the family doesn't actually have to be life-threatening. So we know that actually siblings can really struggle when they're brothers and sisters of kids who have maybe staring spells might really struggle. It's the perception of something as being very dangerous, leading to this traumatic response. So beyond kind of regular stress, things that we think of to watch for are things like re-experiencing. So in kids, you might hear this as just like asking for reassurance, what is it that's going on, what's going to happen, not wanting to separate from their sibling, wanting to know what's going on. They might start having nightmares. You notice them having a big startle response, so we call it hypervigilance. So kind of the fight or flight system turns on, which is good if you have an immediate thing that you need to react to. So the easy thing to think about is when we step out into the street and then all of a sudden you realize a car is coming, you jump back, you don't have time to think about it, your heart is racing, your muscles are pumping, you don't even think about it, you get yourself out of danger, and then your body goes back to normal. What can happen when families are going through a lot of stresses or have gone through trauma is that system never really turns off again. So kind of the changes that happen that are very healthy for you in responding to a short-term accident kind of stay on all the time. So what that means is you might feel restless, you might have a hard time sleeping or eating, you might be really irritable, have mood changes, feel like your guard is always on, have nightmares, have thoughts like you're not doing anything and all of a sudden you're like remembering this really scary incident again. You may find that there are certain smells or sounds that like really set off this reaction in you, and that can happen for both parents and anyone in the family. So in terms of helping siblings cope, the things that I think about is trying to give them good concrete education depending on how old they are. So little kids, what I always think about when we're talking about tricky situations is really focusing on how we build mastery over the situations that kids are in, help them feel like they have a role without kind of overburdening them, and really giving them kind of simple information about what seizures are or what's going to happen, and then kind of resting and then letting them come to you with more questions. So kids typically do a really good job of letting us know when they're ready for more information. So siblings, when they're younger, might not want as much information, and as they get older, you might notice, for instance with a 14-year-old, that these questions really start coming up more and more, and that's the time to really give them more education and kind of follow their lead. If you feel like anybody in the family is experiencing mood or anxiety changes that are having a significant impact on day-to-day functioning, so we all have anxiety, we all feel sad sometimes, those emotions are really important, they're just part of being a human. But we're talking about like stuff that gets in the way of living your best life day to day and really bothers you. I would certainly consider talking to a child psychologist in your area and giving them a place maybe to learn some different skills, some kind of specialized relaxation skills to calm down their body, some anxiety management strategies, and to give your family support. Yeah?
Conceptualized.
Trying to think of what I just said. Specialized relaxation skills.
Specialized.
Relaxation. So it's kind of relaxation. So the evidence-based treatment is called cognitive behavioral therapy, CBT. So the association, if you can read my handwriting, is Association for Cognitive and Behavioral Therapies. This is a large organization of people trained in CBT, and they actually have a find a psychologist in my area kind of search that you can do. So those are people who are trained in the evidence-based treatment to treat. I mean, CBT is evidence-based for depression, anxiety, trauma. So it's a pretty good start.
Thank you.
Sure.
I appreciate the answer. Thank you.
Sure. Yes.
Give some of those examples of what you would say to a young child, like maybe a 7 or 8-year-old?
Sure. So I usually talk about seizures as kind of like a lightning bolt in the brain. So our brain uses electricity, just like electricity that turns on the lights. And what a seizure happens is essentially it's kind of a glitch in your electrical system that happens for a short period of time, and it makes your body do things that are kind of unexpected. So you can kind of change that for the type of seizure that they may be experiencing. And then the big thing to reinforce is, especially once you've been diagnosed with epilepsy, to the extent that you can, you know what, these glitches, your brother, sister is seeing doctors who are getting their medicine to help their brains feel healthy. We're doing things like your brother or sister takes their medicine, they get good sleep. That when kids have a seizure, we know what to do to keep them safe. So really focusing on the fact, even though in the moment, even if in your brain you are going like, oh my gosh, and you're totally freaking out, saying to them, you know what, we have a plan when these seizures happen. Here's what you're going to see. Especially kids at that age, they're very kind of sensory focused. So talking about what sights they might hear, what sounds they might hear, what smells they might hear, gives them a sense of a way to prepare for that, and then giving them a chance to ask questions about it. If you go to places like the Epilepsy Foundation and do some searches, there are books that you can find that describe epilepsy to younger kids. So those can be a really, like what I often tell parents to do is like pre-read that. And even if you don't read it to your child, it gives you language that helps to get you down to their level. Yeah.
Along that line, I have epilepsy in my daughter. The question is up front of our she has dreams about, like she'll see us in a pool of water. And she's reaching down to get us and she can't get us. Because she's seen us have seizures. I've developed kind of PTSD from it. I've gone to like the neurotherapist and stuff like that. I know it's tough. It's tough on her. But I think are there any things that we can do? Like I go to therapy, but you only go so far. They're not there in the house.
Right. Like in the moment when things are happening. Have you connected her with a therapist?
Yes, she's done therapy. They do meditation together.
Oh, good.
He's on acupuncture. Things like that. We're doing those kind of things. We just, the therapists all say that she has a deep understanding of love and stuff like that.
Yeah.
That's kind of where the dream's coming from, I guess. But
Yeah.
it's help with like stopping them, I guess. Is that even a possibility?
So do you have a sense of what therapy actually looks like for her? What skills she's learning?
It's more, I guess, to learn with voicing what's bothering her, I guess.
Yeah, so there are different modes of treatment, and they all serve their purpose. So things to think about if you're connecting for specifically trauma-focused therapy is there are specific programs that are designed to treat trauma symptoms. So if you find yourself in a position where kids are doing more supportive therapy, or if it's like emotion identification and expression, that's all great. Like, that's really important, and that is a foundation to working through the trauma. But making sure that you're working with a therapist who has the specific training in working through traumas, because there is a progression of skills that kids and adults will learn to manage the trauma symptoms. So kind of beyond cognitive behavioral therapy, for people who don't know what that is, essentially means our thoughts, feelings, behaviors, and body sensations are all linked together. And what we want to do is to help kids feel more balanced or more calm, happy, whatever it is. But of course, we can't just say like, feel happier, don't be worried, right? Like, that doesn't really work. But we know that if we can help kids change the way that they think about events, if we can change the actions that they take in situations, so a lot of times, especially with anxiety, it's very avoidance-focused coping. So I don't want to do it, I don't want to go away, I don't want to be away from my brother or sister, I don't want to go to sleep. If we can kind of change that and give them more mastery and more approach-focused coping strategies, and then teaching them to regulate their bodies, that kind of sets the stage to be willing to kind of face the trauma or the memories that are really hard. And then from there, what trauma-focused therapy does is really walk people through specifically different traumas, talk about it kind of over and over again until it loses kind of the emotional distress that happens every time you think about it. So one of the things I guess I would consider is like a trauma, pardon?
Is that why she brings it up a lot then? Is her way of trying to talk it?
Mm-hmm. Yeah, so, and there is a difference between reassurance seeking, which actually feeds into anxiety, and processing it to the point that you work through it. So one of the examples with people who are anxious is it might be like they're constantly asking you questions. Where are we going? What time are we going to be there? Are we going to be there? Is it going to be okay? Who's going to be there? Even though you've answered the same question over and over. That is a form of more avoidance, even though it seems like kids are kind of focusing on it and trying to cope with it. What it does is it actually says, like, if I get this answer, it will be okay. So I'm going to like keep getting this answer, and it's going to make my anxiety go down, and then I'm going to ask again, and it's going to make my anxiety go down. The thing that is tricky, especially with epilepsy, so it's one thing to kind of go through a trauma that's historical, like say you were in a car accident and it's over and done with. That's one thing, but to have epilepsy that can happen anytime, any day, at any point, and it's kind of an ongoing thing, especially for families who are dealing with intractable epilepsy, it's really hard to deal with trauma in the midst of trauma, right? Like, that is a different beast. It's kind of like trying to help soldiers process trauma when they're still at war. And so one of the things to think about with the question asking is, what is the function of the question asking? Is it really to talk through it, which is important? We want kids to express it. We want them to give voice to their feelings and their thoughts. There's always the chance there that as you listen to your kids talk, you're going to have a chance to kind of correct some of the perceptions that they have. So one of the things that can happen is you're trying to protect your child as much as you can naturally, but maybe in some ways then they're having limited access to information that might actually help them feel better. And so they start to kind of create all of these different scenarios that might be going on. Encouraging kids to talk about their feelings. Younger kids maybe draw about it or sing about it, whatever it is. Watch them how they play, if they're acting out medical scenes, if they're acting out seizures or emergency or anything like that. It gives you a sense that that's what they're trying to work through. Encouraging them to talk about it and listening to how they're talking about it might help you realize the specific things that they worry about, and might give you the chance to kind of provide some different evidence, like, you know, that actually isn't going to happen. The thing that happens, I don't know, I have such a hard time of coming up just random examples on my feet, but that they may have kind of misunderstanding about things that may happen, and you're able to provide that reassurance. If they're kind of the larger things that you really don't, like there's just not a good solution, then what we can do is say, you know what, it makes sense that your brain is worrying about that, but you know what, we can't really do anything about that right now. What are 3 different things that we can do right now to make you feel better? And then you can come up with kind of a coping toolkit for them. So get an idea of lists of different things they like to do, games they like to play, relaxation strategies, songs they like to listen to. And if your brain is kind of going off into the future, imagining bad things that happen that you can't cope with, well, like right in this moment, let's pick something to do together that makes us like connect right now and feel better and kind of move past those worries that just aren't solvable. Does that give you some different ideas? Okay. Yeah.
So for people who have more depression and anxiety, or have their depression and anxiety starts once their seizures are less or once their seizures stop, do you recommend the same kind of treatment or something different?
Yeah, so at least the approach that we take to anxiety and depression, it's the same, kind of no matter where you are. The focus might be a little bit different. Sometimes, and I don't know if any of you have experienced this, but what I often hear from families is in the midst of a crisis, that might actually not be when you notice the family struggling. It's when things settle down that all of a sudden you're like, why am I crying all the time? Why can't I sleep? Like things are actually stable right now, but that's the time where you're just like waiting for that other shoe to drop and things really kind of fall apart. I saw a lot of heads shaking to that. Yeah, that's a common experience. Yes?
Do you have any suggestions on how to help a young child realize that their sister is having seizures often and they are different than other children's sisters or brothers, and how they can understand that she's okay even though she's having a seizure, which is different?
Yeah.
Not going to do the same things you want to do all the time or other people want to do.
Well, I think having that conversation, everybody's brains and bodies are different, and ours all do different things at different times and need things in different ways. And so just having that be part of the conversation that you have. How old are the kids that you're talking about?
The seizure child is 11, the non-seizure child is 6.
Okay. And is the 11-year-old typically developing, or does the 11-year-old have some delays? Yeah, because that's part of the thing. Like some of those questions come up. Sometimes one of the things families work through is younger children can start to become more advanced than their older siblings. And number one, like when kids are younger, they have a hard time understanding, like kids are very black and white thinkers and like to understand things in very black and white terms, and like fair is fair and I want, A to always lead to B. And so helping kids kind of understand that over time is important. And I think a lot of it is just talking. I mean, you're just saying like, okay, so there are some things that she does differently. She has a brain that kind of glitches sometimes and it makes her lose control of her body, but then she's back. And then the thing to shift on, as much as we focus on kind of talking about ways that bodies are different, or people learn differently, or people communicate differently, or people have different interests, is, okay, well, and she wants to be loved, she wants to be included, she likes, her favorite color is purple, and she likes to do all of this stuff. And so it's the balance, like, yes, we're all different, and how do we be inclusive, and like what are the things that we look for that are similar?
One of the things that bothers the younger one is the older one is repetitive words or does the same action over and over again. And how to explain that it just keeps going on.
Yeah, and so in that instance, so the question is if there's an older sibling who's doing things like saying the same word, or maybe certain behaviors that are happening over and over again that are bothersome to the younger kids. And actually, when you look at the epilepsy research, I'm getting to your point, I promise. When you look at it, we know that epilepsy is comorbid with lots of different things. So seizures in medicine, yes, and side effects of medicine, but we know that kids with epilepsy are actually at the highest risk for other psychological, emotional, and developmental comorbidities than any other chronic disease population. And the explanation is it happens in the brain. The brain's in charge of learning, mood, behavior, attention, development, all of that stuff. And so if you're having seizures, you may be having difficulties in other areas as well. And so when you look at the research, especially when kids have more behavior disorders, or different kind of challenging behaviors, that actually is a bigger stress to the family system and the quality of life in the family system than even actually having ongoing seizures. So to your point, in terms of helping that, I think at age 6, what you can do is give the education, that's what she does, that's how she communicates, or that's how she shows that she's upset, or, when you talk about those repetitive behaviors, what's the function of those, and then explaining it to it in simple terms. So it could be communication, it could be when kids are bored, stressed, or tired, it could be more of a self-stimulation thing, kind of depending on when it's going, telling the 6-year-old why it is that her brother or sister is doing what they're doing. And then if it's bothersome, what you're doing is you're teaching the younger child, okay, so if that's bothering you, what are some things that you can do to make yourself feel better? So you can get yourself out of the situation, you can help kind of change if it's more of a distress thing, like what are the things that you have control over. But what we're trying to teach the younger kids is whenever we have any feeling, and this isn't just younger kids, whenever we have any feeling, we don't just have to feel the feeling. We can change how we're thinking, we can change what we're doing, and we can change how kind of stressed out or calmed down we are. Those are the same ways that I would approach that situation is I'm feeling irritated. I don't want to feel irritated anymore. So let me calm myself down, let me figure out what's making me irritated, and let me pick something that I can do that's a positive way to cope in the situation, and then really reinforce those behaviors over time. Yeah. Yes. Mm-hmm. Mm-hmm.
Just all of that stuff. And so is that covered in trauma therapy? Do they talk about the disease and everything? Do they explain the disease, or is it just like emotion?
So, probably your average, the question is, you said it, LGS, yeah. So with Lennox-Gastaut, the younger child has LGS, the older child is very worried about it, knows a lot about epilepsy, has heard about SUDEP and is thinking about that as well, and of course that makes them really anxious. In terms of trauma-focused therapy, and the question was, would they specifically address aspects of the disease? I would say if you wanted that specific education, I would do things more like Epilepsy Foundation and have people who are specifically trained in epilepsy, or depending on where you are, there's a few of us, unfortunately relatively few of us, but there are pediatric psychologists like myself who specialize in epilepsy. So if you're near a major medical center, what you're looking for are pediatric psychologists. They tend to specialize in working with kids who have acute or chronic illnesses and are in touch with the healthcare system. Finding someone who comes from more of a children's hospital might have more of that medical background and can help specifically address some of those issues. The other thing is the therapist doesn't have to play all the roles, so maybe the education comes from someone on the medical team, or even having like doctors or someone on your other child's team explain that. Then you have the trauma-focused therapist who's helping the child kind of explain it, deal with it, figure out kind of how to cope with the different situations. And then Epilepsy Foundation, there's Epilepsy Foundation and then other disease camps like, it's probably not what you call them, but like Courageous Kids in Kentucky, the Epilepsy Foundation runs camps. They often have not only camps for kids who have kind of epilepsy or whatever kind of illness it is, but they also tend to have family camps as well. I find getting siblings connected to other siblings who can kind of understand parts about their life that other kids might not be able to is a really helpful thing as well. There's the second one up here, Sib Shops, is the Sibling Support Project. And this was developed as a way to support siblings of kids who have pretty significant developmental delays, but it's starting to include more and more kids who might have serious medical illnesses. And they have groups throughout the country, but that may help give them another outlet to connect with people who can really understand where they're coming from and support them. Yeah.
You mentioned your pediatric psychologist.
Mm-hmm.
I know you usually would work with the child that has
Mm-hmm.
epilepsy, but do you also work one-to-one as a psychologist with the siblings?
Yep, so I can work with the child who has epilepsy, I can work with the siblings, I work a lot with the parents.
How do we just ask for that through our insurance? Or?
Yeah, so it depends. You can ask your neurology team if they're aware of anyone or if there's kind of an established referral stream. That's a great way to go. Talking to your pediatrician, asking if they're familiar with a good child psychologist in the area is great. You can call your insurance company to make sure whoever you're connected with is paneled on your insurance. But those are all really great ways. The thing that I think about with kind of any medical thing that you're going to get is I want someone at least who's kind of tried and true. And so having people like the school psychologist or the pediatrician or your neurology team or someone kind of vouch for that person and make a recommendation is often really helpful. Yeah.
You had mentioned earlier was, because I don't feel like my older siblings have much issue with the seizure itself, so I don't seem to be traumatized, but it's more of the other behavioral issues, like whether it be from a side effect of medication or, and they're like, I said, just be patient, like sometimes I'll let behaviors go, and they're like, you're not treating her the same way. And I'm all, you don't, and how do you get them to understand, and I feel like they put a wall up, like, no, you're just not being fair.
How many families can relate to that? Yeah, I thought so. So those parenting issues are some of the things that I think are the hardest. And kind of the things that we think about is ultimately, so behaviors can come, we know that there are comorbidities of epilepsy, happens in the brain, those are common issues, and certainly a lot of the side effects, or medicines can have side effects that show up in mood or behavior domains. The other thing that can happen is just the adjustment process. So you have a child who's diagnosed with a significant medical condition, you're kind of anxious and adjusting, everyone's been through a lot, sometimes through that process, or kind of for parents not knowing where to set the expectations. Like no one really tells you how you're supposed to approach that. So some families, for all of those different reasons, might become a little bit more lax in the expectations for the child who has epilepsy. The other thing that sometimes I hear is I'm worried about disciplining my child who has epilepsy because if they get really upset, they might have a seizure, or kind of like, how do I discipline them for something that they don't have total control over? So kind of the guiding philosophy for this is we want families to get back to their typical parenting kind of expectation strategies as much as they possibly can. But of course, there has to be some accounting for different kids bring different skills to the table. And that's true, like epilepsy or not, your kids are just different and they're going to need or respond to different strategies at different times. In terms of managing side effects or the behaviors, the thing in particular with side effects, what we try to think about is how we be as proactive as we possibly can in figuring out what are the side effects? What are the triggers for the behavior? How do we, like whereas before maybe your child started on a medicine, they could last in a situation, they had a longer fuse and they could kind of wait it out and it's fine before you have to pull them out of the situation. It could be that AED, like boom, that fuse is gone and there's just like, there's no length left. Once that fuse is ignited, there's a big blow up. So what we try to think about is how do we set up the child to have the most success that they can and just recognize that their ability to tolerate things is just going to be less, and approach it more from the proactive side where we're trying to figure out ways, times, triggers, getting enough sleep to help the kid stay more regulated, and then kind of how to respond when there are those blow-ups that happen. Generally speaking, so ultimately, these kids have to kind of go out into the world, follow expectations, keep their hands to themselves, learn how to regulate. All of those things are really important. And so we do encourage families to really kind of hold the expectations that you have. But there has to be flexibility in that. Again, with kind of all these questions is how do I get the kid to understand? It takes a long time and a lot of cognitive development and really a lot of maturity for kids to start to understand that fair is not equal. And that is something that is so difficult, whether it's discipline, whether it's privileges, whether it's driving, whether it's bedtimes, whether it's whatever, is that as you all know, different kids require different amounts of things or different strategies at different times. And kind of any child in any family will often balk and think, it's kind of a child thing, like, I'm the one who always gets in trouble. And certainly when you have a kid who's acting out more. So I guess there's no simple answer other than to kind of give them a chance to vent about that and say, like, you know what, this behavior, and you can say too, like, this behavior is really hard for me. Like, sometimes I need to take a break because these side effects of this medicine, like, we're glad that, Johnny has a medicine to help with seizures, but boy, oh boy, like, it can make some things hard too. When Johnny's acting this way and I, like, am getting really irritated by it or upset, here's what I do to move myself out of the situation and calm myself down. And you're validating that it feels unfair and it's hard and this is going on, but also kind of you're deciding your limits and kind of reinforcing that with the other kids. Yeah.
So how do you find a balance of not trying to be overprotective, but also trying to be like, hey, you need to do this. My sister, she's epileptic, and I'm like, hey, you need to sleep, you need to do this. And well, you guys are gonna calm down. So we're like, okay, you can do it. Like, leave it up to you, and she won't do it. So I'd be like, hey, you gotta do it, but without pushing her.
And how old's your sister?
She just turned 21. Yeah, so it's definitely.
Yeah, so the question is, how do you encourage people to really work toward their best self-management, but particularly as people get older and kind of have more free will and autonomy over the decisions they make, how do you handle that? So in terms of things like getting enough sleep, like knowing what your triggers are, getting enough sleep, not staying up really late, taking your medicine when you're supposed to take your medicine, getting refills, going to appointments, all that stuff. So it's tricky. So I think at that point, especially with your sister, she's 21, she knows. And so sometimes I think about, like, what is your role? What's the best way that you can support her? Of course, like, we want to have control. Even, it doesn't matter if kids are like 6 or 26. Like, if there are things that you can do to make them healthier, like, you want them to do it, and it just, like, pains you to see someone engaging in behavior that could be counterproductive to their health. On the other hand, the older people get, the more, like, that really is their domain. So what I kind of think about is, do they have, like, is she aware of it? Is she having these discussions with her medical team? You're there to support her as her sister and to be there for her, but kind of understanding that, like, your love is there and you can show your love, but potentially trying to limit conversations around that and just be there as her sister and not as her, like, medical provider there to give guidelines, right? Like, she knows what she should be doing. She's just not doing it because she's 21. Yeah, and that's so hard. Have any parents had older kids kind of go through the teenage years and you're worried about sleep deprivation and not taking medicine regularly, heading off to college managing a chronic illness? Or for any of you adults who have epilepsy, what that was like in your families as you went off with a chronic illness that you were managing? No.
Do you have any ideas for a 10-year-old who won't, like, drink her water, we'll put her to bed, and go back to reading her flashlight?
Yeah. So with 10-year-olds are young enough that you can get, like, really behavior plan with them. So she's, yeah. So some of the things that I think about is if you can build in reinforcement. So one of the things, figure out what it is that she likes most and have her gain access to those privileges only by engaging in the behaviors that she needs to do. Sometimes with drinking water, I'm sure you've tried, like, other ways to get in liquid and getting really clear about how much to drink. So a lot of times, hydration is something that we struggle with all the time. And kids spend so much time during school that if they are not independently managing hydration at school, it's very likely they're dehydrated all the time. And so some of the strategies that can work are getting a water bottle that the kids take to school every single day, and then marking, you can even get them where it's like by lunchtime or by, like, morning break, by lunchtime, by evening time, fill up and do it again. So you have one way that you're starting to measure it, and then trying to figure out, like, what it is. It's like your job as a 10-year-old is to go to school, give good work, and take good care of your health. And by doing that, that's kind of your job. And in terms of that being your job, then you get paid in terms of access to technology or whatever it is that she's working on. And again, you can kind of set the guardrails around it a little bit more. In terms of sleep, it's great that she's staying up reading. I love that it's not staying up taking technology. Yeah. And so I think some of that is just trying to figure out how much sleep she needs per night, getting her in bed a little bit earlier so she has that time, which is great, and then ultimately taking her flashlight and just controlling her environment. Yeah. And then hopefully over the course of time, it will be internalized. But I think at 10, you're just like, well, these are the behaviors you have to do. Yeah. Bedtime, lights off. Yeah.
Can we go back to, you mentioned disciplining and do I be more strict? Do I be a parent that I would normally be, but at the same time aware that my child has her own unique? Which of these, or is there something else you would recommend reading on how to best go about that, or some ideas on how to? So my daughter is 3, she's my one and only, so I don't have that, but I'm trying to learn how to be a mom, how do I be an epilepsy mom. So it's kind of like, how do I discipline her? I come from a strict family, a military family, so it's like, I know what I would normally do if my child was average.
Yeah.
But am I wrong for being as strict? Should I give her a little more wiggle room and kind of struggle with that?
Well, to kind of add to that as well, is because she just turned 3 and she has some developmental delays, it's like, it's really confusing and hard to figure out, is she just a terrible toddler, or is it because she has developmental delays that she doesn't understand? So because she's in that lower age group, we don't know what's what. If it's her or if she really is not getting understanding. So the discipline is really hard to do.
Yeah.
Sometimes we feel bad because we don't know what it is.
Right. So I love that you brought up in terms of understanding chronological versus developmental age too, in terms of discipline. So one of the things that's really important is we are providing education, we're providing discipline, all of that stuff geared at the developmental age. And so if she's 3, but kind of in skills level, she's more like 18 months, then what you're going to want to do is have the expectations and have the discipline strategies that work better with 18-month-olds. And with 18-month-olds, what you're really kind of doing is a lot of redirection. So giving them a positive opposite to do, kind of move them away from situations. Time out at 18 months is like a totally great thing to do. Just take them out of the situation for a minute. But your ability to quote unquote discipline at that time is fairly limited. The things that I think about is always for whatever problem behaviors your kids have, what is the positive opposite you want them to do instead, and go over that as much as you possibly can. So if it's they are touching or hitting or kicking, it's keeping your hands to yourself. If they're screaming inside, it's using an indoor voice. If they're jumping up on stuff, it's putting your booty in the chair, whatever it is. Figure out what the positive opposite is and reinforce it as much as you can. That's gentle touching. I like that you picked up that toy. I like that you listened the first time. You can give kind of physical reassurance, like pat her on the back, give her tons of attention for the things that you want her to do. That way, when she's engaging in the other behavior, there are kind of 2 strategies. One is minor attention-seeking behavior. You just kind of ignore, just walk away. Don't give in. She's playing for tug of war, so don't play tug of war. But if it's more of an aggressive behavior, those are times that a more clear timeout or toy timeout is appropriate. And it kind of depends if she's just turning through. It kind of depends how kind of significant the delay is, because more like 18 months, a lot of the behaviors you're seeing, like tantrums, biting, kicking, any of that stuff, is really the communication that happens at that age. And what we're trying to build is, whenever there's a behavior, thinking about, it's called a functional behavior analysis. Behaviors happen for a reason. They're a tool. They're serving some sort of purpose. No matter what age, what behavior it is, if you can figure out what the purpose of that behavior is and make it not effective and give the child a more effective positive alternative and reinforce that, that will help the behavior over time. I would also say it's a tool And if they've been using it for a long time and it has served a purpose, when you stop letting it serve that purpose, it will get worse before it gets better. Because if they have a hammer and they've been tapping, and suddenly it's not working, they're going to tap really, really hard to make sure that tool's not working anymore before they come up with a different approach. So be mindful, if you change strategies and it gets worse, that's a good sign, because the child is detecting things are changing, and that's when you want to be consistent through that extinction burst, focus on the positive opposite, and then build that over time. The other thing for parenting resources, there's a really great parenting website that actually Australia has that's called Raising Children, but it's raisingchildren.net.au, and it goes through like all of the developmental stages, and then you click like prenatal, infancy, toddlerhood, preschool, school age, teenager, whatever. And then within that, it has developmental milestones, cognitive milestones, common behavior, common difficult behavior, common fears, whatever, and just has like really great strategies right in there, so you can use that as a reference. The other thing you could do is talk to your pediatrician. They may have more like parent coaches who can help you figure out how it is to respond to whatever behavior and give you kind of more, because it's hard enough to figure out how to parent and like discipline for your first child anyway, and it certainly is more complicated when kids have a medical illness. Yeah?
Can you please repeat that resource?
Yes, so it's raising, I'll write it down. And then while I'm writing it down, I saw another hand. Yeah?
Kind of to piggyback on that, I have a daughter who's 10 years old.
Uh-huh.
You know, she used to be pretty good with like amiable and stuff like that. She's starting to show different things, and she's 10. So she's probably developing into like She goes to she has an ABA.
Uh-huh.
But as you mentioned, parent coaches, yeah, I was thinking should even look, seek a child psychologist as a parent, or like more strategies to support the ABAs that would kind of, they're trying to give us some pointers, but I don't know, is that something an avenue, going on?
So the question is, her child is 5 minutes, okay. Her child has an ABA therapist already, which is great, and they're working on some behaviors, and they'll give like some tricks and tips, it seems like, for home, but she's 10 and she's getting a little bit more independent and exploring those boundaries. Would it be helpful to also have someone who provides kind of more parent coaching, how to respond to situations? I would say if you already have a good therapist that you're connected to, the first thing I would do is touch base with them and just say, and I don't know, you may do this already, I would touch base with them and say, here are the behaviors that are happening at home, and we're not really sure what to make of it or how to respond to the situation, and see if they can give you some strategies or coach you in it. If you feel like you need more support kind of beyond that, then because ABA tends to be very individual focused, although certainly the idea is to train the whole family, because consistency across the board will get you the most for it. And then if they're not able to give you enough strategies, you could look for someone who's going to be kind of more parent support focused, but I would start with, if she's already well connected, I would start with that. Yeah. And the down here, Australia parenting website is Raising Children. children.net.au. The CDC also has a good resource called CDC Parenting Essentials for Toddlers and Preschoolers. In that, they have lots of different strategies, videos, guidance on how to manage that age group. I would say with parenting toddlers, again, we're talking about developmental age, so whether that's the same as chronological age or not, it's the same strategies. So CDC Parenting, I think it's called Parenting Essentials. And that'll link you to some great stuff too. Yeah, sure.
The 14-year-old is very helpful to me when I need him, but at the same time, he wants to stay home now and just play video games. He doesn't want to go out with his family. I tend to see that he's overworked and over-anxious because he feels like he has to watch his older brother and his younger brother. So I understand why he wants to stay home. He wants to relax.
So, yeah, are family activities outside of the house a stressful thing?
I think he perceives it as a stressful thing because he's always watching, making sure they're okay. He doesn't have to worry. But when it comes from a parent, he's like, maybe.
Right, and it's still, no matter what you say, like, don't worry, that's my role, he still, like, cares about his siblings. And so sometimes that stuff outside of the home can be more stressful. And this is something that comes up, I don't know if any of you can relate, but sometimes, especially with the things that go along with epilepsy, can make kind of moving about in a community, doing things that you used to do or you thought you do as a family quite challenging. I guess one of the things I would say to him is get him to give you some ideas about what would be fun for him, where he'd be okay going, what's an activity that he would enjoy, and see if you can work with him to come up with something that would both engage him in family time, because that is so important, but rather than him feeling like he's kind of being pulled along and it's more of a stressful thing, see if you can meet him a little bit more where he is, and you may do this to find something that's more likely to be engaging for him. And like having that downtime, I think, is really great and is a relief for kids to, and that's something that I would encourage all parents to get too. Is we didn't talk a whole lot about parents because as parents, of course, you're worried about your kids, and so you're here like gathering as much information as you can for your kids, but really taking that time for yourselves as much as possible too, trying to get as many kind of relaxation time, self-care. You can't pour from an empty cup, so the saying goes. I know that's way easier said than done, but just like your son who might feel kind of overtaxed, it's very easy for parents to not take the care of themselves either. And the research is quite clear that when parents kind of don't actively manage the stress that goes along with having a child with a chronic illness, they're at much greater risk for physical and emotional issues over time. And so taking care of yourselves is super important.
In relation to that, because I'm thinking about another daughter, she's only 3. When they get older, yeah, we do maybe family stuff, but is it also important to do things separately?
Yeah, having dates with each of your kids is a great idea. Like having that time where you just connect with them as individuals is really nice. Especially too, if kind of the family dynamic is such that a lot of energy of the family is kind of taken up by the child who has, or one child who has something going on, then really carving out that time to the extent that you can with each individual time is a really great way. It's quality, not quantity. So it doesn't have to be a lot of time, but make that time something that like really engages, like you're able to engage with each other. Yeah, that's great. Anybody else? I don't know what time it is. Let's see. Does anyone have the time? Okay. Any last questions? All right. Thanks for coming.